The unmet needs in the treatment of dry eye really are, I think we're missing a lot of care of the meibomian glands or the evaporative part of dry eye disease. So I think that once we can better solve those problems and also solve them at an earlier time point, at an earlier age for patients, and actually prevent a lot of the gland loss and gland disease, I think we'll actually be better at treating and preventing dry eye, hopefully. So the TearCare system works. There's two components to the actual device. There's a component called the smart lid, which attaches externally to the upper and lower eyelids bilaterally at the same time. And these smart lids, they're very simple, like to the patient, they're actually quite complex in design and function, but to the patient, it's a very simple, comforting type procedure where the smart lid sticks externally to the lid, very comfortable to wear, nothing goes in the eye, and the patient's actually able to open their eye and blink during the entire procedure. The smart lids connect to a hub called the Smart Hub, and this is also an electronic device that basically helps control through the smart lids the heat onto the eyelids, and it maintains a steady, constant heat at a specific temperature. So the smart hub and the smart lids interact and connect to the patient in order to provide this heat that's necessary to melt the meibum. After that part of the procedure is done, that's the actual TearCare device, the smart lids are removed, the patient is placed at the slit lamp, and then the clinician takes forceps, these special forceps that are called the clearance device, and they're used to individually apply pressure to each gland in order to extract the oil. So it's a two-part procedure, but the beauty of it is that it's all external and nothing actually, the device does not have to go in the patient's eye. So it's described as an open eye experience. So it was a non-inferiority study comparing TearCare to LipiFlow. It was a multi-center study designed over 10 clinical sites in the US. It was single masked and it was randomized. And the goal, again, was to show non-inferiority to the current treatment in the United States called LipiFlow. Basically, the study had 235 patients enrolled. The primary endpoints looked at were tear breakup time and meibomian gland secretion score. There were other endpoints, secondary endpoints that were looked at include symptomatic questionnaire scores such as OSDI, also known as ocular surface disease index, as well as corneal and conjunctival staining parameters, and also analyzing the meibomian glands themselves and using a grading scale to grade the secretion, not only the quantity but the quality. The primary endpoints of the study were met. So both tear breakup time and meibomian gland secretion score were non-inferior. The TearCare group was non-inferior to LipiFlow, which was wonderful. And it actually also showed improvement as well in both groups for the secondary endpoints, including conjunctival and corneal staining, as well as the symptomatic dry eye questionnaire scores as well. What was interesting is that we did find that TearCare actually showed a higher percentage of patients improving from OSDI categories. So they improved. So in the OSDI, as many of you know, is the results are graded into different categories. You can have a normal patient, a mild dry eye, moderate, or severe. In the TearCare group, 72% of TearCare patients actually improved from one category to the next. So that would mean they went from moderate to mild or mild to normal. So there was an improvement. 72% of TearCare patients actually improved. Not only their OSDI score was decreased, but they actually moved or improved from one category to the next. 59% of LipiFlow patients also achieved this, but there were a higher percentage of patients in the TearCare group that improved from one category to the next. And also we found that through the data analysis that there was 22% less use of lubricant drops in the TearCare subgroup than the LipiFlow. So I think the study was great. It actually validates both treatments are wonderful. both subgroups had improvement in the patients. The study met the endpoints, showing that TearCare is non-inferior to LipiFlow, and then also yielded some extra interesting data. So the primary endpoints were the tear breakup time and the meibomian gland secretion score. And just to go in a little more detail, I hadn't really spoken on this earlier. Most clinicians know tear breakup time is simply you place fluorescein in the eye and then you time the number of seconds it takes for the tear layer to dissipate. So most clinicians are familiar with that. A lot of clinicians are not yet performing meibomian gland secretion score, and that was done actually using the meibomian gland device that gently compresses on the external lid and is used to evaluate the quality of the meibum that's extracted from each gland. It's a gentle pressure use, so it can be quite sensitive to see if there's actually excretion of oil or not, which if there was no excretion of oil, it would definitely show a worsened gland. So in the study, we actually pre and post treatments had to evaluate the meibomian gland secretion score. And in both groups, there was improvement. And like I mentioned earlier, TearCare was non-inferior to LipiFlow in improving the meibomian glands, but both subgroups did have improvements in their patients, pre and post treatments. So those are the two primary endpoints that were looked at. So the safety findings, we reported all of the adverse events, and there were no serious adverse events, and all of them resolved without treatment. And again, a lot of the adverse events listed, which we have listed in our paper, included sort of like typical symptoms of dry eye. So there was nothing significant or serious, but we did record all the adverse events. I think that patients are a good candidate when they display evidence of evaporative dry eye disease. I always check all of my patients that are coming in with symptoms or signs of dry eye. I closely look at their eyelid margin and I analyze the glands. I look to see if there's any capping of the gland. Sometimes I'll also perform meibography as a more advanced test to analyze the glands. So I think anyone, first of all, that tells you they have symptoms of dry eye, I actually would still consider for TearCare, but especially if you're noticing evidence of meibomian gland inflammation or meibomian gland inspissation, I think that they could be a great candidate.